Hello, welcome to another episode dedicated to men's health. Today, we're going to address a very important topic, especially for men over 50 who may have started noticing changes in their urinary patterns, nighttime awakenings, or discomfort related to an enlarged prostate. We're talking about benign prostatic hyperplasia, also known as BPH, one of the most common urological conditions in older men. Before we begin, take a deep breath. This is your moment to understand what's happening inside your body. Calmly, clearly, and without fear. Each piece of information here is meant to empower you, to help you make informed choices for your prostate health. Let's start from the beginning. The prostate is a small gland in the male reproductive system, located just below the bladder and in front of the rectum. It surrounds the urethra, the canal responsible for carrying urine out of the body, and its main function is to produce part of the seminal fluid, which nourishes and transports sperm during ejaculation. As men age, hormonal changes naturally occur. Testosterone, the main male hormone, is gradually converted into dihydrotestosterone DHT, a more biologically active form. When DHT levels become excessive, they stimulate the prostate cells to grow. This slow, progressive growth is what we call benign prostatic hyperplasia, non-cancerous enlargement of the prostate. Now pause for a moment and think, have you noticed a weaker urine stream? Do you wake up multiple times at night to urinate? Do you feel like your bladder never empties completely? If you answered yes, these may be early signs that your prostate is pressing against your urethra, restricting urine flow. These are known as LUTs, lower urinary tract symptoms. They can be divided into two groups, irritative and obstructive. Irritative symptoms include urgency, increased frequency especially at night, nocturia, and the constant feeling of a full bladder. Obstructive symptoms include a weak stream, hesitancy to start urinating, or even complete urinary retention. Even though BPH is benign, it should never be ignored. An enlarged prostate can affect bladder function, overworking the detrusor muscle and, over time, weakening it. If left untreated, it may lead to urinary retention, recurrent infections, bladder stones, or even post-renal kidney failure caused by chronic obstruction. Take a deep breath, because this is where early diagnosis makes all the difference. Men over 50 should schedule yearly visits with a urologist, including a digital rectal exam and PSA blood test prostate-specific antigen. These tests assess the size and texture of the prostate and help rule out prostate cancer, which requires a completely different approach. But here's something few people talk about. Daily habits may be silently worsening prostate enlargement. And that's exactly what we're going to explore now. Many believe prostate growth is purely genetic and unavoidable. But research tells a different story. Factors like diets high in saturated fat and red meat, low fiber intake, excessive alcohol, smoking, and sedentary lifestyle all contribute to prostate inflammation and enlargement. Recent studies also show that oxidative stress, the imbalance between free radicals and antioxidants, plays a key role in prostate cell proliferation. The higher the inflammation and toxin buildup in the body, the greater the chance of prostate hypertrophy. That's why adopting healthy habits is one of the most effective strategies for preventing and managing BPH. So pause again, and let's absorb these next essential recommendations. First, focus on an anti-inflammatory diet. Add foods rich in lycopene such as cooked tomatoes, watermelon, and red guava, a powerful antioxidant proven to lower prostate inflammation. Also include omega-3 fatty acids, found in fish like salmon, sardines, and tuna, which balance hormonal activity. Another important nutrient is zinc, present in oysters, pumpkin seeds, and nuts, crucial for testosterone regulation and prostate health. And remember, limit caffeine and alcohol, as they can irritate the urinary tract and worsen urgency and frequency symptoms. Now take a deep breath, because this is just the beginning. In the next section, we'll explore therapeutic strategies, both pharmacological and natural, used in managing BPH. You'll understand how each option works, its benefits, limitations, and when it's truly indicated. Get ready, Part 2. We'll bring you insights that may transform how you care for your prostate asterisk. Now that you understand what BPH is, how it develops, and its main symptoms, let's dive deeper into treatment and management. Pause briefly, because this is where many men make mistakes through self-medication or believing in miracle cures. The treatment of benign prostatic hyperplasia depends on symptom intensity, degree of obstruction, and impact on quality of life. For mild cases, your doctor may recommend active surveillance, regular monitoring through checkups, and lifestyle adjustments. Without immediate medication for moderate to severe cases when symptoms interfere with sleep, work, or daily activities, pharmacological treatment becomes necessary. There are two main classes of medications for ABPH. The first, alpha block. These relax the smooth muscle of the prostate and bladder neck, improving urine flow. Common ones include tamsulosin, alfuzosin, and doxazine. They act quickly, often within days. However, they may cause dizziness, low blood pressure, and sometimes retrograde ejaculation. The second, 5-alpha reductase inhibitors. These drugs, such as finasteride and dutasteride, block the conversion of testosterone to DHT, reducing prostate growth stimulus. They take longer benefits appear after 3 to 6 months. They're ideal for larger prostates above 40 grams. Possible side effects include reduced libido and erectile dysfunction. In some cases, doctors use combination therapy, merging both classes for better results. Beyond medication, standardized herbal therapies have gained attention in integrative medicine. The most studied is Serenoa repens, also known as saw palmetto, which modulates hormones and reduces local inflammation. Others include Pygeum africanum, urtica, dioica, nettle, and beta-sitosterol, all with promising evidence. Pause to reflect. Never start supplements on your own. Even natural compounds can interact with medications. Always consult a healthcare professional before use, and when medical therapy isn't enough. In cases of chronic retention, recurrent infections, bladder stones, or renal impairment, surgery may be necessary. The most common is transurethral resection of the prostate TURP, a minimally invasive endoscopic procedure. Other options include laser enucleation and prostate artery embolization, both offering excellent outcomes. Now let's address a key aspect often overlooked: urinary health. The bladder also ages and adapts. Simple habits like staying hydrated, avoiding holding urine for long periods, and practicing pelvic floor exercises can significantly improve symptom control. Equally important is metabolic control. Insulin resistance, abdominal obesity, and metabolic syndrome are linked to increased prostate growth factors. So, managing diet and body weight isn't vanity, it's urological care. Take another deep breath, because in Part 3, we'll cover preventive strategies, daily habits, and long-term actions to keep your prostate healthy and functional for years to come. Asterisk. We've reached the final section and perhaps the most crucial one: how to prevent BPH progression and maintain optimal prostate function as you age. The first rule: regular medical follow-up. BPH is chronic and progressive. Ignoring it won't make it disappear. It will likely worsen. So make annual visits to your urologist a priority. But there's much you can do every single day. Start with functional nutrition. Favor a diet rich in antioxidants, berries, cruciferous vegetables like broccoli, cauliflower, and cabbage, and sources of vitamin E and selenium. These reduce chronic inflammation and regulate prostate cell growth. Avoid ultra-processed foods, loaded with sodium, refined sugar, and trans fats. They fuel oxidative stress and systemic inflammation. The second pillar is physical activity. Aerobic and resistance exercises enhance pelvic circulation, regulate hormones, and reduce abdominal fat, one of the top contributors to prostate dysfunction. Third, emotional balance. Chronic stress increases cortisol, disrupting hormone levels and raising inflammation. Relaxation practices, meditation, deep breathing, stretching positively influence prostate physiology, and don't underestimate restorative sleep. During deep sleep, your body releases growth hormone and restores endocrine balance. Poor sleep worsens hormonal imbalance and nighttime urinary symptoms. Pause and think. Prostate health doesn't rely on one single factor. It's built on a lifetime of consistent choices. Every meal, every night of rest, every act of self-care adds up. Finally, remember this: your prostate may be small, but it plays a major role in reproductive and urinary health. Caring for it is an act of respect for your longevity. If this content helped you, share it with others. Information is the most powerful tool in prevention. Take care of yourself, and see you in the next video.